We have all seen recent headlines of nursing strikes, clinicians committing suicide, and so much more. Today, over 60% of our healthcare workforce faces moral injury and burnout, and this leads to over $60 billion in losses each year. Awesome. Well, it's great to meet everyone. My name is Veeraj. I am the co-founder and CEO of Vitalize Care, and we work to improve the mental health of healthcare professionals. But before I share more about Vitalize, I wanted to start with my story, which for me begins as a patient. So I grew up with a chronic disease that left me spending most of my early birthdays in hospitals. But my clinicians, they were with me every step of the way, from rushing all the way to the emergency room when I couldn't breathe, all the way to getting accepted to my dream colleges. And they were my second family. So I've spent hundreds of hours over the past few years right by their side. But it wasn't long until I realized how all of these clinicians around me were emotionally drained. They were depressed. They were burned out. I recall days where they lost all will to see any patients. And I didn't realize it then, but Vitalize started at that exact moment. We have all seen recent headlines of nursing strikes, clinicians committing suicide, and so much more. Today, over 60% of our healthcare workforce faces moral injury and burnout, and this leads to over $60 billion in losses each year. But let's take a step back. Burnout in healthcare is defined by a high degree of emotional exhaustion and depersonalization. And it has so many root causes in healthcare, from poor staffing, long hours, grief, and so much more. But this problem directly affects patient care every day. We currently face staff shortages in the millions, which are only going to get worse. So Vitalize seeks to build a new care model for the mental health and professional support of clinical teams and staff. For this population, we're building a virtual mental health service led by experienced coaches who are clinicians themselves and uniquely understand our users. For healthcare employers on the other side, we track staff mental health and provide tailored recommendations on how to support staff wellness while improving the bottom line. Today, clinicians and staff who need support are typically referred to what's called employee assistance programs. They typically wait over a month to get any care, and it's typically one-on-one therapy staffed by people at their own institution. We've also seen hospitals adopt generalized mental health services, but we've seen incredibly high rates of attrition across over 300 user interviews. So how does our specific model work? We have three parts. First, live group and one-on-one coaching centered around the unique challenges of working in healthcare. The second, text-based peer support that's both identity and specialty-based. And third, mindfulness content focused on navigating acute stress in healthcare. And our model is influenced by years of academic research, investigating peer support and coaching specifically for clinical teams. We're simplifying the entire mental health journey for clinical teams and healthcare employers by being a single point of access. We're going to be able to eliminate month-long wait times and networks of point solutions. And from published data of small-scale coaching interventions, we estimate that our specific care model can generate upwards of $4.2 million in cost savings per year for an average hospital. And we're confident that now is the perfect time to build a company in this space. Not only is our market large and growing, but both employers and the federal government are investing in the mental health of this specific population at an all-time high. And our revenue model behind this is B2B. We sell our platform, both our app and our dashboard, on a per clinician annual subscription that starts at $10 per month. And we launched our MVP in summer 2022, where we converted an unpaid pilot then into a paid health system annual contract for over 2,000 people, where this health system actually prepaid for our entire product. We then used this traction to fuel our sales pipeline, where we've quickly secured multiple LOIs in the past 2 months and are negotiating over $1 million in contracted ARR across our 2 customer verticals. So for the next year, we're currently hyper-focused on a few things. The first, collecting clinical data from our initial customer launches, and 2, scaling our early customer base. Our 2023 goal is to get 12 paying customers across hospitals and EMS with over $1 million in contracted ARR. And we're really excited because we built this team that's going to make Vitalize the category defining company. We combine multiple previous healthcare ventures, published research on this specific topic of clinician mental health, over 10 years of clinical experience in hospital sales, and experience building behavioral health products that have been used by tens of thousands of patients. But to end, for me, Vitalize was always intensely personal. It was a way to pay it back to the clinicians who have been with me my entire life and that I wouldn't be here today without. We're really and honestly humbled to be part of the StartUpHealth family, and we have an incredible group of investors backing us today. So we're currently looking for connections to hospitals and digital health companies that are interested in being early customers for Vitalize. Thanks so much.
Awesome. Thanks for sharing, Veeraj. You talked about how your coaches are clinicians as well, so they understand, and you're obviously going to be coming up against behavioral health companies that treat mental health and burnout more traditionally. So tell me more about what makes the platform unique sort of for and by clinicians.
Yeah. So one of the first things we learned after all of those user interviews, spending thousands of hours in hospitals, is the fact that no one understands clinicians better than other clinicians. We further validated this through our pilot in the summer, and that's where we've come up with a specific coach profile that powers all of our services, both our coaching and our peer support. These are people with typically more than 5 years of clinical experience. We look for national accreditations and board certifications as health coaches, and years of experience doing specifically this type of health coaching within the clinical team's population. And we have a lot of conviction in this model for a few reasons. Number one, like I said, they know exactly what everyone who's using this platform is going to, and we can focus everything around the unique challenges of working in healthcare and the acute stress behind that. But second, this is a relatively new workforce. Health coaching in general is a new concept, and there's a lot of academic literature still coming out around it. But it's a really unique opportunity for us in this next year to be able to move all of our coach training in-house outside of the accreditations. So it's a real opportunity for us to be able to scale this entirely new workforce that doesn't have a lot of these supply side constraints that traditional therapy focused models would have.
Interesting. You talked about converting a pilot to a paid client. And I'm curious, what were the success metrics that really sold them on it?
Yeah. So when we started that pilot, our product was honestly really different and in full transparency, a lot worse than it is now. It transparently was headspace for healthcare in a lot of ways. There was not the coaching piece to it, and there wasn't the peer support piece to it either. We learned that by launching a pilot in Midland Health, where we had a group of about 100 clinicians that were very, very engaged in what we were doing. And we just called them all the time to ask about everything that they really wanted. And what they said consistently week on week was they want coaching and they want opportunities to be connected to peers where it's all optionally anonymous. This gave us a lot of conviction in our coaching model, where we then spec'd out, this is our vision and this is exactly what the product is. And the health system was so excited because it was really also perfectly timed in that they were looking to revamp their entire suite of mental health services for staff in that health system, and they wanted to center it around Vitalize. So the timing worked out, and they love the product vision. So because of that, we were able to convert it within about 3 months of finishing the pilot.
Nice. So that's working with a health system. Do you have any thought towards getting reimbursed in the future through payers?
Yes, we do. Right now, we think that's about a year out for us, but there are two cool market forces that are working here. The first is that the type of mental health coaching we do is currently a CPT-3 code. As early as 2024, it can become a CPT-1 code, and that is super exciting for us because we can start billing for payers for the major pillar behind our product. We think that's going to allow us to scale across hospitals and health systems a lot faster, and also EMS a lot faster, because it eliminates some of the financial risk side for health systems adopting this that is there in this B2B SaaS model. But the second is we are collecting massive amounts of data across this year. Our goal is to reach over 50,000 healthcare professionals across a lot of these early implementations, and all of them have clinical data collection embedded. We think that this is a very cost-bearing part of a member population for payers that work with hospitals. So ultimately, what we're going to do is be able to potentially work with payers in a per engaged user per month model, because our entire model here with Vitalize is focused on preventative care for mental health. And that's the second way that we're thinking about working with payers.
Yeah. Your presentation obviously builds on what Dr. Houston talked about with HPEC and the burnout that's going on. And so my last question for you is, at the bigger sort of health moonshot level, how are you hoping that this company shifts the culture of healthcare? We think about the next generation of physicians. Right now, it feels tenuous with this product scaling the way you think it can. How do you think you can shift culture in healthcare?
I mean, I think first of all, our vision is to be able to completely rewrite what support for healthcare professionals looks like. We know that burnout in healthcare is super complicated, and it's really difficult to say that one specific solution is going to solve this problem, because that's really naive. I really see solving burnout in healthcare as a network effect, right, of a lot of different solutions, like what Dr. Houston provided, like what we do. So from a cultural side, I think there's a few things that we do really, really well with Vitalize. Number one, we allow clinicians to be connected, greater connection to their peers and their managers. And second, their profession in general. By placing clinicians leading services at the center of our entire product, we allow for a great sense of ownership, of pride, and connection to the actual things that clinicians are doing and why they started this and why they embarked on this journey in the first place. And that's caring for others and helping for others. And that's constantly reinforced in our product. Rediscovering purpose is a major theme reflected on all parts of our product. So we hope to do it a few ways. We hope to be able to improve culture that way. But the entire second side of our product is focused on providing health systems with data at both unit levels, department levels, and organization levels, tracking different indicators of staff mental health, risk of moral injury, and data on cost savings. And we think this is going to be able to support this very fragmented ecosystem that typically tracks this, where HR does a survey once a year and no one at the other levels of the organization has actionable intelligence to be able to change the workplace. So that's our, in a long answer, multi-pronged vision of how we're going to be able to do this.